is making sure that underwater basket weaving was eligible!
You just assaulted me, buddy!
We found out that nobody questions, criticizes, nor runs security background checks on trannies.
What son of a bitch! Son of a bitch!
Oh, bankrupt America, man is dumb. Follow us, change eyes.
So my wife is filming today. See if it, just for verification. See, I just squeezed her posterior. That's the beauty of having a ring. I can do it whenever I want. I don't need consent.
Steven Crowder is one hell of a force to be reckoned with. An unstoppable force. No matter what you throw at him, he'll keep coming up with shittier and shittier arguments. Arguments so bad that you question if this guy loses arguments to himself. But one thing that I really hate is people who spread misinformation. And I personally think Steven Crowder is a huge source of misinformation. Take for example this clip from Steven Crowder in which he tries to debunk free healthcare by showing how terrible it is in Canada. By literally fucking flying to Canada.
All right, first things first. We wanted to head down to the local clinic and see what kind of treatment we'd get there. But it was the weekend, and as people in the emergency room later told us, so I guess the clinic is closed?
God, you can almost smell the shit stains on his underwear. The way he attempts to open a door is with so much callous, as if he thought once he opened a door, he'll be welcomed with great righteousness. So, you purposely chose to go to the clinic on a weekend just to film this bit, even though in the United States, the clinic is also generally closed on a weekend. You didn't have to go to Canada for this. Also, I don't think they would just let you walk in. Pretty sure you'd need an appointment. You fucked up twice here. It's almost as if Crowder has never been to the doctor before, which, given his current condition, would make sense.
I hurt my wrist skateboarding.
Can you move it?
Yeah, but I get numbness just to make sure that nothing is wrong. Nothing is serious.
You just want to make sure you have to wait your turn.
Yeah. Now, once you see the nurse, of course, you have to wait again for a doctor. And as a lady at the front desk had told us, that could take a while.
It's been an hour and a half so far. We just saw the nurse, and they're about to send us to, well, now we're just in another waiting room waiting for the doctor. And they can't give us an idea as to how long the wait's going to be, between 2 and 10 hours. So now we wait. We'll keep you posted.
It's been an hour and a half because you're not high priority, you fucking idiot. You said you hurt your wrist but can move it. There's no reason a doctor should waste their time with someone who probably just sprained their wrist, as opposed to people who are in critical condition or actually require emergency care, such as a woman in labor. Remember, you're inside an emergency room. A sprained wrist is not an emergency. They do this in hospitals in the United States as well. So far you wasted a plane ticket and the time of some other patients who could have been waiting for something they have actually had. He then goes on and talks about people who injured other bones and had to wait hours to see the doctor.
A guy with a broken clavicle who was in there, it took him 5 hours for a turnaround to finally get his care, and they finally couldn't do anything. They just told him to go see an orthopedic tomorrow.
But, Crowder, let me ask you this. How many people did you see with a knife through their jugular or a woman in labor in the waiting room for hours? None? Oh, okay. It's like he acknowledges that he isn't high priority, but yet still decides to keep this bit in the video. Let's get to another video.
Obamacare has serious problems. Deductibles are too high. Premiums are too high. The cost of health care is going up at a much faster rate than it should. Ideally, where we should be going is to join the rest of the industrialized world and guarantee health care to all people as a right. And that's why I'm going to introduce a Medicare for All single-payer program.
This is what Bernie Sanders does. He talks about how student loans are too high. Therefore, more free college.
You're comparing apples and oranges. Obamacare is expensive, but that doesn't mean Medicare for All would be more expensive. Saying this is extremely misleading. A good comparison will be comparing the costs of Obamacare versus Medicare for All. With Medicare for All, the cost will be null for the individual, but will be paid for by increasing the tax rate. So while your tax rate will go up, you'll actually be saving money. A study done by Yale epidemiologists found that Medicare for All would reduce US healthcare spending by around 13%, or $450 billion a year.
Medicare for All, which is an entirely broken system. I'll continue to get into that, but a liberal think tank estimated that Bernie Sanders' proposed plan would add $32 trillion in federal spending over the next 10 years.
Right, that's actually saving money. According to CMS, as of 2018, the US currently spends $3.6 trillion a year on healthcare, which in 10 years, that's about $36 trillion. Medicare for All would cost around $32 trillion, so $32 trillion versus $36 trillion. I think this math problem may be a bit complex for Crowder, so I'll just spare you the time and tell you that 32 trillion is less than 36, which, by the way, would save you over $400 billion a year. Not to mention, Medicare for All would cover around 30 million uninsured Americans. This argument will only work on people who can't do basic math. Luckily, I finished the first grade, a whole grade higher than most Crowder fans.
This is coming from a leftist think tank. This is the best case scenario.
Alright, now let's look at another video in which Crowder talks about climate change.
Of the climate curve.
Oh,
That's a new curve.
Huh? What? So many curves!
Ah, yes. Fantastic argument. Talking about other curves that need to be flattened. How dare you talk about more than one thing that needs to come to an end? Is Steven Crowder unaware of what a fucking graph is?
Who's most affected by the 𝐜𝐫 protocol, which would skyrocket energy costs, which for us is mildly inconvenient because you drive a crossover, but for someone in Zambia, or honestly, you don't have to go that far, for someone in Mexico, if you can wander out of your Cancun booze cruise resort, they work all week just to get enough fuel so they can heat a can of beans on an old ironing board in a drum.
So, if I'm understanding this correctly, Crowder is saying that energy costs will be higher with the Green New Deal, which would make it even harder for people who are poor or live in a third world country to afford to use energy. Okay, where is Crowder getting his information on this? He doesn't cite any sources and just states it as if it's a fact that renewable energy is more expensive. Well, according to the International Renewable Energy Agency, renewable energy is cheaper than non-renewable energy, meaning it'll be cheaper to afford to use renewable energy than non-renewable energy. Just to clarify, the International Renewable Energy Agency is a peer-reviewed, highly credible source. So, Crowder, what sources do you have that state otherwise? Because throughout this entire video, he has not given a single source to back up his claim that renewable energy is more expensive.
Yeah, listen, my position, and I think everyone here on climate change is not, there's no such thing as climate change, I don't know the science. No, listen, I think the Earth has warmed. I think that humans may be contributing a significant amount to it. As to whether we'll have catastrophic results, I'm not entirely sure.
What does Crowder define as catastrophic results? It sounds pretty subjective. Projections have shown that by 2050, up to 1 billion people who live in coastal regions could be displaced due to floods. Climate change can also lead to droughts, wildfires, etc. If we don't do something about climate change now, it can only get worse and may not be reversible.
Donald Trump wants to pull out of the Paris Climate Accord. So this is something that everybody is talking about right now. Good. I'm all for it. It's one of those issues where I've had a rough couple of weeks. I have no problem praising Donald Trump. People will say you're a climate change denier. That's not necessarily the case. A lot of people will present this argument, and I understand it. They say, listen, if climate change, though, if it is real, and if it is catastrophic and imminent, don't we have to do something? Why wouldn't you do something? Okay, well, let me give you a few arguments as to why we wouldn't do this thing. This proposal would create an average shortfall of nearly 400,000 jobs in the United States. That's over 200,000 manufacturing jobs. An income loss of more than $20,000 annually over the course of this proposal for a family of four. GDP loss of the United States for up to $2.5 trillion, an increase in household energy expenditures by 13 to 20%.
What you forgot to mention was that jobs will also be created. I mean, should we have never built cars since it would replace horse and buggy jobs? All of these statistics come from a March 2017 study prepared by NARA Economic Consulting. The $2.5 trillion drop in GDP is modeled if the cost was very high, which probably isn't what the cost of energy would even be. The same goes for the income loss being over $20,000. To top it off, the study isn't taking into account the benefits of avoiding climate change, such as sea level rise, greater storm surges, greater spread of diseases, etc. All of these things will also affect the economy greatly. The economy is going to take a hit either way. Now, I want to move on to something that may be extremely frustrating to hear, and that is Crowder's misguided and dangerous opinions towards COVID-19.
Get out.
Yeah.
Oh,
I watched that and I go, hold on a second. We don't know this. Maybe this mom had only one mask and gave it to her son. But at a certain point, how about you just don't go? Don't go to the small group.
Yeah.
Don't go to the grocery store if every single other person has to wear a mask.
How about don't go to the grocery store if you can't follow their rules? Why is it people like Crowder don't understand that these stores are someone's property? It's not a public area, meaning they have every right to tell you to get out of the store if you're not complying with their rules.
Ultimately, when you want to call the cops, you want to call a man with a gun because a mom is in a grocery store with her child who isn't even sick, most likely, and not wearing a mask, which the CDC told us wouldn't be effective anyway.
Okay. First off, in that clip that Crowder showed, no one was mentioning anything about the police being called, so that was complete lie number one. Second, I like how he says call a man with a gun as if the cop will shoot the woman for not wearing a mask. But I do agree with that people should not call the police on people not wearing a mask. However, again, that's not what was happening. People were just yelling at someone to get out of the store for not following store rules, which is totally fine. The sign literally says you can't enter without a mask. She was essentially trespassing.
Well, what do you think's gonna happen when they look back here and they see that it's a slightly bad flu season? When you take away the 25% of deaths that actually were never tested, or they're listed as death from COVID, when really it's death with COVID.
Here's a shocker. Everything Crowder just said was completely misguided. Let's start with this first point, and that is that 25% of COVID deaths aren't tested, meaning that 25% of COVID deaths are inflated. He gives a source to this claim in a separate video, in which he links a source to the article stating this claim.
I do tend to agree with Dr. Birx that it's inflated up to about 25%. Specifically, at least 25%.
The article he links gives no source to the claim that which Birx admits that COVID deaths are inflated by 25%. I'll link it in the description below so you can see it for yourself. However, Dr. Birx was asked this question in a task force meeting, and here's her response.
Virus. There are some commentators who are suggesting that the number of dead are being inflated because they're saying that people who are dying with other issues are being listed as COVID-19 deaths. Perhaps you've seen some of this commentary. You may be too busy to see it, but it is out there. What do you say to those folks who are making the claim without really any evidence that these deaths are being padded?
We've made it very clear, I think, every time I've been up here about the comorbidities. And so most of the people, and we talked about the Italy data, the majority of the Italians who succumbed to this had 3 or more comorbidities. So this has been known from the beginning. So those individuals will have an underlying condition, but that underlying condition did not cause their acute death when it's related to a COVID infection. In fact, it's the opposite. Having that underlying condition and getting this virus, we know, is particularly damaging.
As you can see, when Birx was asked if COVID deaths were inflated by counting deaths that aren't actually COVID deaths, she essentially passes it off as bullshit. Meaning the patient's previous health conditions made COVID more deadly to them, but it wasn't that pre-existing conditions that killed them. It was COVID. Dr. Fauci also responds to it by calling it a conspiracy theory. I'll link this video in the description.
You will always have conspiracy theories when you have very challenging public health crises.
So far, Steven Crowder gave essentially no evidence that Birx or anyone is saying that COVID deaths are inflated by 25%, besides a terribly written article with no sources. Now, let me address Crowder pointing out that COVID deaths are listed as COVID deaths when the person is not actually tested for COVID. This is true, but it's not like if someone was hit by a car or shot in the head, they would be counted as dying from COVID. And it's not like if they were killed and then later tested positive for COVID, would it also be considered a COVID death. There has to be reasonable clinical evidence to suggest that COVID may have been the ultimate cause for their death. Here's how the CDC says a medical professional must perform a report on death. It states in CDC's Vital Statistic Reporting Guidance that in which Part 1 of the death certificate on reporting untested COVID deaths, or really any deaths, quote, this section on the death certificate is for reporting the sequence conditions that led directly to death. The immediate cause of death, which is the disease or condition that directly preceded death and is not necessarily the underlying cause of death, should be reported on line A. The conditions that led to the immediate cause of death should be reported in a logical sequence in terms of time and etiology below it. Meaning, you can't say that a person was hit by a car or consumed a deadly substance to commit suicide was a COVID death. It must have a logical chain of events that leads to COVID being the ultimate cause of death. Now, as far as COVID deaths being overcounted using these measures of including deaths of patients in the COVID death count that didn't actually test positive for COVID, is a bit complicated. You see, if they were to only count COVID deaths as COVID deaths with patients that test positive, then the total COVID death number would be undercounted since there's limited amount of testing, and a lot of deaths that clearly show evidence that it may have been a COVID death will go uncounted, thus resulting in an undercounted death toll for COVID if we were to do what Crowder says we should do. Now, if you want to say that you'd rather go with an undercounted death count rather than an overcounted death count, then that would be way more dangerous, since if we were to have an undercounted death toll, then that would lead people and even healthcare professionals to not take the virus as seriously, which would lead to even more deaths.
And then you remove the people, by the way, who just died in New York City because of an absolutely abysmal, mind-numbingly bad policy that sent sick old people back into nursing homes like a buzzsaw. You end up with a number that's closer to 50,000, which is moderate flu season.
I actually partly agree with Crowder on this. I do think that Cuomo's mandate was very stupid and did increase the spread of the virus, which resulted in many deaths. But it's not like this was the main spread of the virus. Nursing home deaths were at its highest prior to this mandate, which all stem from nursing home staff spreading it in the first place. I understand that Crowder is saying that these nursing home residents wouldn't have died if this mandate didn't exist, which to an extent is true, but to say that this greatly contributed to the total death toll in the United States is a huge stretch. If we look at the numbers, nursing home deaths in the United States account for about 40% of the total death toll for COVID, which at the time of this recording is about 110,000 deaths. Let's say for argument's sake that all of the nursing home deaths were caused by this mandate spreading the virus when it wouldn't have otherwise have spread, which of course is totally not the case. But for the sake of the argument, I'm going to take Crowder's argument and try to play it out with the hypothetical perfect conditions. That would still mean that around 200,000 people that weren't nursing home patients died, which, to put into perspective, is over 3 times more deadly than the flu, which kills about 60,000 people a year. To top it off, it hasn't even been a year.
2 million dead is what they said. 2 million dead unless you get to work, Mr. President. And President Trump took them at face value. He said, okay, all right, 2 million dead, it's time to get to work. We're at less than 5% of that.
Wow. That's insane.
We're at less than 5% of that. How is that not a resounding success, an overwhelming victory, unless you, experts, were in fact wrong?
The study that said that 2 million people would have died from COVID was from a paper authored by Neil Ferguson, an epidemiology professor at Imperial College London. The paper stated that if everyone were to just go about their normal day, not social distance or wear masks or anything, then it's possible that around 2 million people could have died. However, to say that Trump saved 2 million lives because only 200,000 people died is ludicrous. Trump had essentially nothing to do with that. It was mostly due to states locking down and the fact that people were shitting themselves and locking themselves down in bunkers before anything. The Trump administration was, however, responsible for putting travel restrictions on people coming from China. However, these restrictions were set in place a good bit after we already had our first cases in the United States. Experts say this only really would have been effective if these restrictions had been implemented before any cases took place.
Right the whole way. And I also don't understand when people say Donald Trump's side. Well, what side is he really on? He was the guy who went out and advised lockdowns. He was the guy who went out and advised masks.
The CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time. But this is voluntary. I don't think I'm going to be doing it.
Does this sound like Trump was advising mask wearing?
Remember, the death predictions were 2.2 million. Of course, we're not even close to that. The CDC said don't wear masks. Then, of course, they reversed that.
The CDC never said don't wear masks. They said they don't recommend mask wearing for those who don't have COVID. Alright, so now we're going to the final part of the video, and that is Crowder's election fraud claims. So, he shows a video of a woman talking about how the place in which he went in to vote was giving people Sharpies, which apparently if your ballot is filled out with a Sharpie, it'll be thrown out.
And they're voting with their pens, and they literally went around and they were yanking pens out of their hands.
Yes, they tried to do that to me, and I took the Sharpie and I hid it, because then they said, look for all the Sharpies that are not being used and take the Sharpies back. They had a bowl of pens behind them that they were not giving to people and only giving Sharpies out.
There we go.
Wow. So they start presenting this video as if it's evidence that the election is rigged, even though it would be impossible to know who is or isn't a Trump voter. It was shown that this woman was voting in Arizona, specifically Maricopa County, which Maricopa County has stated that a Sharpie can be used to fill out your ballot.
Did you know you can use a black or blue pen or Sharpie to fill out your ballot in Maricopa County? The new tabulation equipment only reads the ovals, so bleed-throughs are not a problem.
Any ballots that have Sharpies should be discounted, and there should be a recount with those.
Saying we should recount all ballots that were written with Sharpies because of a video on Twitter is fucking pathetic. The amount of so-called evidence it takes for Crowder to be convinced of election fraud is insanely low. This is the same retard that isn't convinced that Medicare for All is cheaper than what we have now, despite massive amounts of evidence. but yet gets convinced by a fucking video on Twitter showing absolutely zero evidence of anything.
Things get done correctly.
wagon.
And you're going to see wagons and
That's
other
a wheel-wed wagon.
strange implements. So this is either a horror movie or something worse.
Wow. I mean, you wouldn't be able to trust that just because some ballots could fly off the back.
There's absolutely zero evidence that those are even ballots, let alone ballots that belong to Trump voters. What goes through your mind thinking these are ballots? And I know that I'm making a bold claim even assuming that you have a mind, but considering that you seem to have a large production crew, how is it possible that all of them seem to be dumber than the next? But anyway, it was later found out that the guy was just wheeling in a box of fucking batteries.
The video starts ominously enough. An unmarked white van at 2:30 in the morning outside the TCF Center, and a man unloading something into a wagon.
Looks like one of those lockboxes.
The woman recording is 𝐜𝐫𝐶, a Texas lawyer. 𝐜𝐶 even did an interview about it with a conservative radio host. The mystery man is Channel 7 veteran photojournalist Josh Bowron. He was working the election with me that night, and this was shot at the end of his 12-hour shift.
This lady could have simply cracked her window open, and as a 7 Action News representative, I would have gladly told her that it was a box full of batteries.
I'm absolutely gobsmacked by the fact that Steven Crowder has over 5 million subscribers. The fact that he averages around 1 million views a video just takes what little faith I had in humanity and just fucking crumbles it. The fact that millions of people watch a video and just take in the information without doing any research on the shit that is being projectiled into their fucking brains really grinds my gears. Hopefully, if you are a Steven Crowder fan and you've watched this video to the end, which I highly doubt, that I cured you from the zombification that Crowder has infected you with. And with that, fuck off.